The following program is a Town of Colonie television production of the William K. Sanford Town Library.
I'm the director of Dignity-Albany. Those of you who come often can probably say this instead of me, but I'll say it anyway. Dignity-Albany is an independent organization, nonprofit organization, with a dual mission. The first part of our mission is to provide a forum for learning and talking about very wide variety of life issues like we are today. And the second part of our mission is to advocate for the passage of medical aid and dying legislation in New York State. And so you are going to be hearing about both of those parts of our mission today. We look forward to hearing from our speakers, and we'll have some time for questions afterwards. So, without further ado, we wanted to let you hear from our great colleague Amanda Kavanaugh, who is the campaign coordinator for our partner organization, Compassionate Choices. And Amanda will bring you up to date on where we stand today in terms of our legislation.
And thank you all for being here today. It's great to see so many faces. Election results out of the New York campaign put medical aid and dying in a good position for 2019. Previously, the control of the Senate was held by Republicans who opposed the pending legislation. The powers now shifted to the Democrats. We have a leader and a healthy majority of lawmakers who do not oppose the legislation. In New York, the powerful chair of the Senate Health Committee and a stalwart opponent of the medical aid and dying law, Kemp Hannon, lost his seat in an upset defeat. The lawmaker likely to chair the Senate Health Committee is someone who's publicly supportive of our bill. We'll find out in January if he becomes the chair of the Health Committee, but Senator Gustavo Rivera, a co-sponsor of our legislation, is hopeful to take the next seat. The Assembly will continue to be controlled by the Democrats, although there will be some changes in committee memberships that we won't know about for sure until January. Our bill sponsors and outspoken proponents in both the Assembly and the Senate did very well in their races, including one who is facing a very tough challenge and added his name as a bill sponsor just 3 weeks ago. Governor Cuomo handedly won re-election to a third term. While we've maintained consistent communication with his staff, and our campaign director isn't here today because she's actually in a meeting with his staff, we have not asked for, nor has he taken a public position on medical aid and dying legislation. We have our work cut out for us with at least 40 new members of the state legislature to educate over the next few months. In the coming weeks, Team New York will be meeting to discuss campaign strategy for 2019, and we'll be sure to communicate the next steps with all of our supporters. We need your voices more than ever. There are a few things that you can do today to get ready for what's to come in the next legislative session. December 10th at 7 p.m., we'll have a campaign update call that night where you'll meet some new members of our campaign team here in New York and hear about how the election results will affect what we're doing. Joining us at the Capitol will be crucial for 2019. Besides our campaign launch event and a spring lobby day, as we've done in the past, we'll also plan to have a presence in Albany every Tuesday that lawmakers are in session. We'll ask supporters to wear our signature yellow colors, visit with key lawmakers, and help us distribute advocacy materials and breaking news. You can check out your calendars now and pick at least one Tuesday or more that you'd be willing to join us, and you just contact me to RSVP. Other ways to be a helpful advocate, as well as keep up to date on our campaign, is by connecting with us via social media. You can follow us on Facebook as we share breaking updates, thought pieces, advocacy opportunities, and important news. Twitter has also become an important platform. Increasingly, lawmakers are paying attention to advocacy messages via Twitter. We're going to be holding a specific Twitter training sometime soon where you can learn how easy it is to amplify important advocacy messages. Before concluding, I would like to thank Senator Breslin for being here today. I look forward to hearing the audience's questions and Senator Breslin's thoughts about the upcoming legislative session. I also want to mention that there's this new fact sheet that Nancy helped create, and it's over on the table. Not only does it have important facts and reasons to support the legislation, but it also has information about what lawmakers are in your area, so it's an easy way and a tool to use to contact them. If you have any questions or would like to be more involved, I will be sticking around at the end.
Thank you, Amanda. So we are so pleased and so honored to have Senator Neil Breslin with us here today. And if you want to make your way up to the front of the room, I will do a formal introduction. The Honorable Neil D. Breslin has served as the Senator representing parts of Albany and Rensselaer counties since 1996. And congratulations on your re-election. How many of you are Senator Breslin's constituents? Lots of us here today. We're easy. He currently serves on the Senate's Committee for Insurance, Banks, Education, Finance, Higher Education, Judiciary, and Rules. Born and raised in Albany as one of 6 children, he majored in political science at Fordham University and then attended University of Toledo Law School. Before becoming a senator, he practiced law in several law firms, including one that he formed with his 2 brothers, Michael and Thomas. He is still practicing law as of counsel to the firm Barclay Dana. Senator Breslin has been a leader in improving his community for many years. His leadership has benefited such local organizations as Arbor House, St. Anne's Institute, Hospitality House, the International Center, the Interfaith Partnership for Homeless, and it goes on and on, including a number of impressive appointments in his other professional life as an attorney. Senator Breslin has received many awards and honors from a wide range of regional and national organizations. So we are very honored to have the Senator with us today. And instead of a more traditional presentation, we thought it would be interesting to have kind of a fireside chat interview format. So the Senator will be interviewed today by our own Nancy Willie Schiff, who is a mainstay of our organization. Nancy is retired from a career in research, teaching, and administration in higher education. As an advocate for medical aid in dying, she heads the End-of-Life Choice Task Force at the First Unitarian Universalist Society of Albany, coordinates the statewide New York UU Network for Medical Aid in Dying, and is an active volunteer with Death with Dignity-Albany and with Compassion and Choices. So Nancy.
Thank you so much for coming today.
Delighted to be here.
We invited you long before the election. It turns out to be much more exciting than we ever imagined.
And for me too.
So the first question, I thought we'd start off by talking about the election. For the first time in a decade, your party will have a majority in the state Senate. And so we'd appreciate your observations about that.
It's really the first time in forever. In 1938, the Democrats were in the majority in the Senate for 1 year. Then in 1964, they were in the majority for 1 year. And essentially, in 2008, they were in the majority for 1 year again. We won the majority by 1 seat in 2008. And when you're a Democrat, you're in a diverse group. You have upstate, downstate, you have black, white, you have gay, straight, you have every possible kind of Democrat. And generally on the other team, this is not meant to, they're older white men. And they're much easier to corral. And I'll give you one example. We went into the majority, and I had had a bill for 14 years for a parking permit for people who lived around the Capitol, who were being just displaced for their parking permits by people who worked there. And there were bills being passed all over the state, but I couldn't get mine passed because I was in the minority. And so I went into the majority, I scheduled a vote, and a young senator, Dan Squadron, was on his honeymoon. So I had to put off the vote. I asked a number of my Republican friends, and they said, nothing personal, Neil, but we're on a team, and we're opposing you no matter what you put up. So that was the kind of situation. And then shortly thereafter, Pedro Espada and Hiram Montserrat, who coincidentally went to jail later, switched to the other team. So we were now one seat behind the Republicans. And that was the end of our 2-year stint. This time, and I might add too, blame both Democrats and Republicans because we redistrict ourselves. So every 10 years, because of a fluctuation in population, there's a redistricting process, and the Senate comes up with a redistricting plan, which always favored the Republicans because they were in charge. The Assembly, because they're Democratic, they came up with their own plan for themselves that favored the Democrats. So the Democrats in the Assembly sold out the Democrats in the Senate, and the Republicans in the Senate sold out the Republicans in the Assembly. So you came up with an unfair plan. And that leads to bad government, because what it leads to is districts that aren't competitive. And the House of Representatives, there's that group of 80 Republicans that just vote against everything. They're in safe districts, so there's no consequences to when they do that. Because the redistricting my district was surrounded by Republicans, when they made the plan, they just threw all the excess Democrats into my district. You want to look for competition. If you have competition, you end up with good representatives, and you don't end up with these people who have been around as long as I have. Now, I might add there's exceptions, so we'll talk about that later. So fast forward to this election, there was a number of factors that entered into it. These districts were becoming overwhelmingly Democratic. Almost 3 out of 4 voters in the state of New York are Democrats, yet we continued to be in the minority. We were overcoming that, and we were assisted by one person. Anybody know who that person might be? President Trump. And so a lot of people were fed up and voted for us, and hopefully, in my opinion, we had the best group of candidates we have had in my time in the Senate. Very thoughtful, young people who are doing it for the right reasons, ran very hard, and lo and behold, there are 63 senators. There are now 40 Democrats and 23 Republicans. Yes. Hallelujah. And so what happens is they can't be influenced by getting one person to shift over to the other team. It's a team effort. We're going to stay together and hopefully act as team members. And I might add that on January 1st, when we will come back and convene on January 9th, I believe, but we'll be back at the beginning of January, there will be 15 new Democratic senators. I've met every one of them. They're an extremely impressive group. They are far better than the ones they're replacing. And in many cases, they replaced the members of the IDC. Just briefly, that's the Independent Democratic Conference. And they're the group that, when people tell you it's not about the power, not about the money, it's generally about both. And so they went over to the Republican team because they got chairmanships, they got bills passed, and they had a very easy life. And there was a degree of cooperation, in my opinion, with the governor, that the governor liked having one House Republican, one House Democratic. I believe that you should abide by the wishes of the electorate. If you run on one team, you should stay by that team and have some degree of loyalty. obviously with exceptions by disagreeing with pieces of legislation, as I frequently disagree. And so some people, and I'll go back to the subject, some people try to label me, and when they try to do that, I can say in 1 year, I received an award from Catholic Charities, who I do a phenomenal job in our area, and I also got the Dorothy Sanger Award for the state. So I didn't tell each other, but it don't catalog people, and I think that when we get to the point of dignity with dying, talking to this new group, we're going to have to do some educational research to make sure that you understand who they are, and they're coming in bright-eyed, as they say, bright-eyed and bushy-tailed, and I think we'll do a phenomenal job for the people that stay in New York.
Thank you. Can you tell us something about what we can expect from a Democratic Senate in terms of priorities and agenda? We've seen some things in the news,
Right.
But if you could share that with our audience,
Yeah,
that would be great.
I think I'd start with, because my skill area is insurance, and that kind of flows into healthcare, and healthcare is number one agenda on most people's radar screen, if not 1, 2, or 3. And there's a lot of talk about a one-payer system or a Medicare for all system, which has a great deal of validity because of, when I go home at night and I have a little teeny glass of wine, I turn on the television and I see our hospitals competing against each other with healthcare dollars going up in smoke to pay for the TV ads. And I see middlemen, HMOs, that are selling insurance, and then, and that's not healthcare. And I went to an HMO in this area that does a terrific job as an HMO, and had a new building, but one floor was for sales, and one floor was for marketing, and one floor was for the executive branch. So I can be a smart aleck. I asked the president, I said, do you have any floors dealing with healthcare? And that's really what we're facing. And we want to make sure that everybody has health care. And I've been around the country on the Affordable Care Act. And the first question you ask people to find out where they're at is say, do you believe that health care is a matter of right? I happen to believe health care is a matter of right. And if you don't, and you believe that it's it's a part of an inheritance that you've received because you have a lot of money, you're not on my team. And I remember going to a southern state where I kind of debated with the governor, who said, we ain't taking any of that federal money. And essentially, in my response, I said, essentially you're saying that you don't want minorities to have health insurance. And that's exactly what he meant. He was a medical doctor himself as well as governor. And the idea that we could let people who had less money not have the health care is something to me that's un-American. So we have done a terrific job in New York State in the utilization of most of what the Affordable Care Act has allowed us to do to enhance and increase the number of people uninsured, and we are at a position we've never been at before. There's still people who are uninsured. We have to correct that, but it seems to me that we will do that before we move towards a single payer, because a single payer system means you have to ask the federal government, President Trump, for waivers on Medicare, Medicaid, health plans, the Affordable Care Act. And he's certainly not going to give it. And Governor Brown in California has tried, unsuccessfully, they haven't gone to a single payer. Vermont tried it, hasn't been fulfilled. So there's a ways to go. But there's still, if there's a ways to go, we look to make sure the uninsured are covered. And there's many people in this audience who are perfectly content with the health insurance they do have. However, we would all say it's too expensive, and we have to keep that down. So that kind of gives you that we won't be going quite that quickly in that direction. I expect to have healthcare hearings for the next year or so. There's lots of other things we can do. First, I think that we are somewhere around 40th in the states in terms of availability to voting. We restrict people. There's no early voting. You need an excuse for absentee voting. We have to change that. We have to make it easier. There are people, and it's a Democrat-Republican thing. There's a lot of Democrats who work in jobs where you don't get time off. And we have to make sure we make those times available so that there's an equality in the process of voting. And I would expect that would be one of the first things we'll do. We have to do campaign finance reform. Elected officials can't be receiving the kinds of contributions that they do, because even if they're not doing anything wrong, it gives a bad impression. And I would even suggest we have to look to government-funded elections for both Democrats and Republicans, for both challengers and incumbents, because it will equalize the battle. And you'll get better people as a result, and it won't just give the tremendous advantage to an incumbent. And so I can look to the end of my career, if I keep pushing these bills. But I think there's much movement in that direction. These LLCs, the limited liability corporations, that we use, and we call them people, and you can set up 50 LLCs, which means that you can give 50 times the amount that you're allowed to under the law to a political party. That's insane. I expect to see that changed in the months of January and February. And we could go on and on and on. There's a lot of low-hanging fruit. And I expect to be a part of an organized, disciplined, thoughtful approach to making sure that there's debate on issues that we haven't passed before, so that there's participation, and if not participation, at least knowledge by all of you to the kinds of things we're doing, so that you can comment on an ongoing basis. And we're much better off if that happens. I might add that in my first 12 or 13 years in the Senate, there was never a bill that got to the floor that didn't pass. What that means is, what happened was the Republicans controlled the House. And they only put bills on that they wanted to pass. I've never understood it, why you wouldn't allow bills to be debated and defeated. It's okay. If a democracy's working, you debate a bill and you take a vote, it's up or down. But for 12 years, every bill passed. And I can remember, generally because my kids have been all over the world a lot working, I usually see the government people come from other countries. And so I was with a group of legislators from the old USSR, from different countries there, and I was explaining our system of democracy and what happens in the Senate, and that for 12 years only the majority bills passed. In fact, I usually embellish by telling the truth that when those years in the minority, I had a different quality of paper that was given to me by the Senate, and cheaper pens. And there's a great system of each senator gets to name a woman of the year. It's a terrific ceremony. There's a luncheon, there's a booklet handed out, but it only included Republican women. And so when we took over the majority, we included both sides, and now when it went back to the Republicans, it is both sides. And there's a veteran of the year. And for my first 12, 14 years, if only Republican veterans were eligible. In fact, one of my, and some of you may know her, Mary Jane Smith, who was the founder and the head of Unity House, who was a dear friend of mine. And I thought that she just had done an admirable job in creating Unity House, and it's turned out to be a remarkable institution. And I named her, and she told me that she had been named by Senator Bruno a number of years ago, but she turned him down because it didn't include Democrats. So I was doubly delighted to award her. So I think that, I'll be very careful. If you see me getting so far afield, just raise your hand and I'll make sure I get back to the subject.
Thank you. I guess to get right to the heart of this group's
Sure.
interest, how do you see the Medical Aid in Dying Act fitting into the agenda of the Senate this year?
It's hard to, Nancy, it's hard to say. I should also say that Nancy and I have known each other for several decades. Right. That's a hard one because with 15 new Democrats and really there's only about 8 or 10 long-term serving Democrats, I'm not sure. It certainly will be much better than under the Republicans. I still think there's a way to go. I haven't totally committed. I think I've probably said, Nancy, if it gets to the floor, I will vote for it, if I recall correctly from it. It's a hard one. I'm an Irish Catholic, so there's some barriers there that we have to cross and overcome, debate. I have two parents, obviously two parents. My mom and dad both passed away in hospice under wonderful care at St. Peter's Hospital. Nancy and I were chatting before, there's, to me, many similarities in the way that they passed to death with dignity. So there's, to me, a lot of discussion still needs. I'm not so sure that, I don't think we've exhausted hearings. You might correct me.
Oh, well, there was a hearing in the Assembly.
I know there was a hearing in the Assembly. None in the, I could not find any in the Senate.
That's correct.
And it seems to me, hearings are wonderful if you don't restrict the people who testify, because they really bring out a lot of factors. And reading and preparing for today, I thought about there weren't a lot of documents from the religious sector. Then Nancy and I chatted before, and I was very happy to learn that the Universalist Church is in the forefront, which they always are, and not surprisingly, you have a wonderful pastor too. I'm not surprised because I know he's very much in support. So, did I answer that question? No, I did not fully. So I would attack. I would say, ask for hearings, and I could even suggest that if anybody denies them, because death with dignity would not be covered by insurance to start with, unless there was legislation passed. I could see an insurance company saying, that's not legal under our state, therefore we won't pay. That was only my interpretation with reading the documents, and I can stand to be corrected. But I don't see any reason why if someone else wouldn't have hearings, that I couldn't, I could have hearings.
Right. Does anyone have an answer to the question about insurance coverage?
What type of insurance are you talking about?
To cover the medication, I think it's something.
Well, health and any coverage that dealt with the death with dignity, it would seem to me if it wasn't viewed under our current statutes as being legal, I could see an insurance company denying all coverage attendant to it.
So,
Amanda Kavanaugh comes to the rescue. Right.
the way that it works in states where it's currently legal, health insurance companies do tend to pay for it, but federal money can't be used to pay for the prescription.
But that's in states where it's legal.
Right.
I'm saying it's not legal yet here in New York State.
So right now they wouldn't cover it, but once it becomes legal.
Well, it seems to me I could answer that question then. If it became legal, it would be covered in New York State.
Well, and it would be a prescription for medication.
Sure.
That
Sure.
would be the...
Well, if that's the only, you're suggesting that's the only incremental cost.
Well-
I could see an insurance company.
Well, there are, physicians have to do counseling of patients.
Yep.
There has to be an attending physician and a
Right.
consulting physician, and possibly a mental health professional if there's questions
And
about
I wouldn't want
capacity.
that covered. Right.
So that would all have to be covered if it
Right.
became legal.
Right.
That's correct.
Yeah. Commitment.
Yeah.
Uh,
I don't really feel that you strongly support this issue.
I think that's probably I'd say it's a little strong, but it's like my area doesn't really get into that. So I focus on my area, and the fact that when you need me, I'll be there is a little weak. haven't taken it as, I mean, if you knew some of the issues, I'm the author of HMOs used to be able to file a sheet of paper for a rate increase. It's called file and use. So they did it for 14 straight years, and the insurance went up at the rate of about 15% a year. So I created prior approval. Prior approval means that it has to be reviewed by actuarials who are working for financial services for the state of New York, and it has to be approved because it's justified, and the legislation is significant. And it was in my skill area. So there are lots of bills that you would say, gee, you're a little lukewarm on that. And from your perspective sitting there, you're correct. From mine, when you need me, I'll be there. Yeah.
Let's
So-
hold further questions until then.
Sure, because we may cover them. So are there people who will probably be on the Senate Health Committee that we should know about, who would have the expertise that you're mentioning?
You will know the health committee members in about 2 weeks.
And how will we know?
I'll tell you.
Okay. I'll look forward to your email.
What happens is there's a process that goes around. It's a democratic process. All of the current and new senators fill out their priorities for 8 different committees, and they do it by priority, and they go down. Obviously, my first priority would be insurance, and there's an expectation I'd be chairman of insurance. And the new ones would do the same. A little bit of an advantage to veterans, but if they want to be on the health, there'll be a lot of new people on the health committee. And I think you're correct. I think Gustavo Rivera is very much in favor of death with dignity. And I expect that he will be the health chair. And there's no reason that even though I'm lukewarm, I've talked to other senators, and certainly there's the senators I've talked to, it hadn't been on their priority list because they really hadn't thought a lot about it. They had their own skill areas, and it's not an easy area to feel warm and fuzzy about. It's one of those areas where you get down to it. You're going to have to really, I mean, it isn't like passing a speed limit change. It's a very thoughtful, and we're all going to use individual situations that we have experienced in our own life and watch our loved ones at a stage in life where they don't think things happen properly, and they want change. And Nancy, I know, we're all well aware of insidious diseases that take people at a very early age with an extremely high degree of predictability. And we've watched them suffer and suffer and suffer unnecessarily.
Yeah, well, just to follow up on that, at the present time I have 2 friends who have a diagnosis of metastatic cancer.
Yeah.
And so I personally feel a sense of urgency because I would like them, and I think they would like as well, to have the peace of mind to know that they could take charge at the end if they need to, so that they could live fully until then. And so it's not an abstract, as you know, it's not an abstract idea, it's very real.
And you think of people with Huntington's disease and others that are just insidious.
Right. So you're saying basically, since this isn't your specialty, it's not something where you would be a leader in the Senate on this particular issue. That is what we're
Probably
hearing.
not. And and there wouldn't be, you wouldn't be expected to. You'd want that chair to take the ball. And there's a process where if a particular Senate, like Campanen, I assume that Campanen had religious problems with him. I don't know. But that someone else in his conference would have said, okay, then do you mind if I take the ball and run with it? Mm-hmm. And I don't view that as a problem in our conference.
Okay, because we do know that this has not really been a partisan issue. Former Assembly member Janet Dupre has been an outspoken advocate
She
at
was
the
great, too.
Assembly hearing.
She was great.
And she's a Republican.
I know, but a great,
Yeah.
she's a terrific
Yeah,
person.
you know, she's a fabulous advocate.
And
Yeah.
John Bonisick had a bill.
Right.
And there might
So
have
as you
been-
say,
and-
it's often personal reasons.
There probably might have been some personal reasons that people stayed away with it because Diane Savino was part of the IDC.
That's true.
And that might change now, too,
Yeah, yeah.
that she's
So-
back in the major leagues.
So once we learn who the health committee members are, would it make sense for people in the Capital District to contact them, even though they may not be our lawmakers?
Yes, I would expect that I would get a call from Nancy, and she would say, would you give me a list of the priorities that we would want to go see these? And I'd be delighted to.
Okay,
Nothing
Okay.
wrong with that.
okay. And then when we do contact lawmakers, some people here may be in districts, Senate districts, where their lawmaker is on the health committee, because they're not all in your
Right.
district. So what would you suggest are the most effective ways of reaching people? What do you think about letters versus emails versus phone calls?
I really believe that phone calls and letters are good, but not as critical or not as important as episodic. Bring examples. Bring examples. They really are the ones that frequently sway me. And this would be an area where I'd strongly recommend that. And I'm being on Death with Dignity on a continuing basis. I have several friends who are in the same categories as your friends. And when they talk to me, it's compelling.
Amanda mentioned social media and Twitter and Facebook.
Sure.
Are those effective in your view?
Absolutely.
Yeah? Okay.
Absolutely.
So
I think of the stumbling blocks that we've experienced over the years, and I think one of the most exciting times was marriage equality, and there was a time when 80% in polling, 80% were against it, and you watched it move away, and Governor Cuomo has to be given a great deal of credit for doing that and making a lot of people very happy who were unnecessarily unhappy before.
Well, I guess that is the end of my questions, except if you have any other suggestions for us about how we can advocate.
Yeah, I always think for the Brain Injury Association, several other groups, I try to lecture every year on how to best lobby. And there's nothing wrong with that. And episodic is what I said. Give the legislator information beforehand. A lot of lobbyists come in and they don't give me information until the end because they control the conversation until then. And the more information I have, the better equipped I am to follow them and participate in what they're telling me. I personally don't like it when they say, I'm a constituent, because I hopefully treat everybody the same, whether they live in Hudson or live in Albany. And, but that's just a personal thing. And it's like, oh, okay, I'll listen to you now. Right. So, but just be honest. I mean, this is an issue where you should really get the attention of the senator. And try always to see the actual, I've always, anybody who's come in to see me, I tried to see everybody. And because it seems to me if I have a staff person meet with a group, that means the staff person's got to tell me what the group said. And it loses its personal flavor. So it takes a little more time, but to me it's much more effective. If I hear the story and I know the facts, and I try to then have someone who's kind of taking notes if I slip up on something, but try to see the actual elected official. And you'll run into roadblocks. There'll be some elected officials who try to do it a different way.
Thank you. Are there questions from the audience? And if you don't mind coming up and using the microphone, or just stand? Okay.
The difference, I can repeat it probably. It's saying I gave it a very good analysis. No. I provided some analysis on the Senate. What about the Assembly? And the Assembly by Constitution has 150 members. I might add that's a floating number in the Senate, and that it can be changed, as it was to create an additional district 4 years ago that runs from Amsterdam to Kingston. But it's 150, and I believe there are, give or take, about 106, 107 Democrats, and you know, the remainder of the 150 Republicans. But it's better than a 2-to-1. Yeah.
And how did that change?
No, it didn't change. It changed by 1 or 2, but not much at all. And ours changed. Another way it changed dramatically in the Senate is that they used the other team, the Republicans, to put out a map of the Democrats in upstate New York. And there was one in Buffalo and myself in Albany. And so, and then you saw a concentration down in the metropolitan area. And they would say, well, they're not going to get anything done because there's only 2 of them. And, you know, and I used to kid with Tim Kennedy was saying, well, let's form an upstate coalition. We'll flip a coin to see who's chairman. But that's changed dramatically because we now have a senator in Syracuse. We have several senators in the Hudson Valley, another one in 3 in Westchester, and there's nine Senate seats in Long Island, and 6 of them are now Democratic. So there's a good cross-section of the state. And I expect, hopefully in the next couple of weeks, we'll be forming some non-metropolitan group, not as a competition to the metropolitan area, but a counterbalance, if you will. Yes, Judge.
First of all, I am so happy that New York State is finally going to take its rightful place, thanks to the elections, as one of the progressive states in the country, and congratulations to you for that. And I hope that we are progressive on.
Right.
I'm going to put you on the spot for just a moment.
Sure.
Because you mentioned insurance share, which is a logical thing for you. But given the upstate-downstate divide, I would think that the Senate Democrats would want an upstater in a leadership role, not taking on the legislative place, but at least in one of the top leadership positions and as a senior member of the Senate for the state, if there's anything we can do to make sure that.
I'll make sure, I think I'm fairly close to the leader, Hunter Stewart Cousins, who's the first woman to run a conference in the state of New York and the first African-American woman. And it's terrific. She's wonderful. And over the years, I've been the head of finance for the Democrats in the Senate. I've been the deputy leader.
I've also been the floor leader, running what the operations on the floor. And then insurance, and I was the longest serving president of the National Conference of Insurance Legislators. So, because all insurance is state-based, so you don't always have the right answer, so you look to other states and we get together as a unit. And I was president of that organization. And so my skill does belong there, but I hear you, and I expect to have a lot of participation by upstaters. And as long as I know that I'm not I tell Andrea, I don't make phone calls well. I don't like, and so I don't bother people. But that she knows that I'm available anytime she wants to talk to me, and we talk frequently. And upstate will be represented, should be represented. And our future is upstate. Progressives. Okay.
Yeah, my name is Glenn Letetti. I'm an attorney, and I have been in the past fairly involved with 89 Bar Association. And I just wanted to point something out as you talked about Huntington's disease, Senator. And it's important to remember that medical aid and dying is not available for chronic conditions, which is what Huntington's is. So there's a lot of people will say, well, if aid and dying is legalized, you're going to be pushing people with various illnesses and diseases to end their lives. but medical aid in dying is only available where it's legal to terminal patients. And a terminal patient is defined as someone who, with or without treatment, is reasonably expected to live for 6 months or less. So I would hope that you and your colleagues would appreciate that fact. Now, certainly Huntington's or ALS can become terminal, even though it's a long-term chronic condition. But I think it argues against aid in dying to think that anyone in any of these conditions is just going to ingest.
I'm sorry if I gave that impression. I didn't mean to.
But I think it is important to realize that distinction. And in reality, in most cases where people utilize aid in dying where it's legal, it's really only in the last few days of their lives where they ingest the medication. Most of these people are thoughtful people who want to live a long time and who are concerned about quality of life and other issues. And so they fight as long as they can, and it's only at the end when things become insufferable, when they can't do anything anymore, that's when aid in dying comes in.
Can I ask you a question?
Yes.
Is it, do you find that it's dignity in dying is done on an informal basis in hospice programs?
Currently, you could make that argument. I mean, certainly, I've witnessed 3 people in my life who have passed away, and certainly at the end where people are suffering, the morphine is very freely utilized. The problem is, though, that by then people are writhing in the hospital bed, in the living room, or in the hospital. They're messing themselves. They don't have control over things. Seconal, which is the primary drug used for aid in dying, gives people a much more peaceful death. It would be a substitute, certainly, for the methodology that's used now, and it would probably only shorten people's lives by a few days in most instances. And I certainly would want that for myself.
Sure.
I was only using it in terms of presenting an argument to those people who are saying for various reasons they do not want to participate in it, but when you question them, they've actually participated in something very close to it. And it enhances the argument.
I just wanted to follow up on your question about aren't we doing this anyway through hospice? Yeah. Since I've been involved in this campaign, I've heard stories where hospice doesn't always work.
Right.
And there's testimony from people on the Compassion Choices website where people in New York State have had bad deaths, even when they're in the best care in the best hospitals. And they would like this option to take charge, because hospice, the patient doesn't have control. This is more of a patient-centered control.
But to some people, when you argue with them, that's a stepping stone. That if you could get them to acknowledge that they've participated with someone close to them in a process going towards death with dignity, the argument might become easier to them, rather than saying, no, I reject it, because I'm in this faith or that faith, and we reject that totally.
You're saying that hospice is, we've already accepted hospice and morphine.
Right.
Okay.
Yeah.
Thank you.
I've been a hospice volunteer for 23 years, and I want to clarify, and I'm not sure I understood. Sure, sorry. Number one, the deaths in hospice don't happen if somebody decides anything. The morphine is used to control pain, and people become accustomed to it and need to use more. Eventually, there's enough morphine that may depress the respiratory system. But it's never used on purpose and help somebody die. I've been asked many times by people in the hospital if I could help them. And the answer is I'd love to be in some news tube, but I can't. So there are also people in hospice who, strangely enough, morphine doesn't touch. I can remember a young man in the day, years ago, who, when I came in, was screaming. He was screaming and screaming. And he was writhing. And I went to the nurse and I said, I think this man needs some more medication. And she said, we're giving him as much as possible. It's not touching him. He, in my view, would have been a good candidate for this. Except, Hospice is a very good program. I recommend it to everybody, but it isn't the answer.
I might also add, I have my
Admiration for you for being involved with hospice for 23 years, and they've done so much for so many people. Thank you.
I was going to say the same thing, thank you.
Yeah.
My mother is one of the reasons I'm here, you know, and we all, I'm sure so many of us have these stories. She was a strong Catholic, Irish Catholic like you, and grew up in Catholic schools like you, and was totally opposed, and we used to have a spirited discussion. She was very educated. And hospice was wonderful, but yeah, they weren't able to help her enough at the end. She wasn't riding in pain, but she, at the end, looked at me and said, I want to go. I want to go, let me go. And watching this and being helpless, as we are, is not a good feeling. She would have benefited from this. My dad, unfortunately, died of dementia, where we can't help. That's something that Death with Dignity is not going to help us with, but that would be either. But she would have been helped, and notwithstanding the wonderful work of hospice. So we need this.
So, I'm a physician, and I just want to say, in terms of the limitations of morphine are absolutely real, as this gentleman volunteer said, and by the way, thank you so much for your service to the hospice community. The other thing they don't tell you about is that morphine is also associated with severe problems with constipation and delirium. And so sometimes when you give enough morphine, people are really no longer with you anymore. And so this idea of terminal sedation, which is this accelerated use of morphine, Senator, that amounts to what we were talking about, amounts to death with dignity. By contrast, a lethal dose of secabarbital, Secanol, as the attorney said, Mr. Witecki said, is it's a remarkable way to exit this life. You give the dose. In fact, they tell the patients, drink it all immediately, because pausing in the drinking, you may drop the glass. So in the first 10 minutes, slumber. The second 10 minutes, of the 20 minutes, they are in coma, and usually in 30 minutes, they've departed. It's an extraordinary journey to the end of your life, and very peaceful. So a lot of people do not know the nuts and bolts of the end of your life at secabarbital, but it's extraordinary. It really is.
So thank you.
Well, as many of you in this room also did, I had the pleasure of attending the hearing at the Assembly on this issue. And although I consider myself quite an expert on the subject and an advocate for it, it was a very, very valuable pro and con discussion. It was very civil. It brought up many ideas I had not thought of myself. I wish everyone could listen to the tape. I know nobody has the time. However, you say that the Senate has not had a hearing. What is the best, understanding that in 2 weeks there are going to be new members on the Health Committee, how do you recommend that we can get the Senate to have a hearing?
That's a good point. I'd start with the
Appropriate committee, it's the Health Committee. I know when we were in the majority, it seemed like I was having hearings every day, and I was the one that made those decisions. I was the author of the first autism bill in the state of New York, and it took us hearing after hearing after hearing, because every case of autism is a new and different kind of a case. So it's to get to the appropriate chairman or the leaders of Andrea Stewart-Cousins, who's my leader, to the Senate, and through your local senator to get to the right people. So
talk about how hearings aren't just a given in New York, and we do have to really work with the lawmakers to make it happen. It's quite the challenge to get one in the Assembly.
Right. I don't view it as a challenge. I wouldn't view it as a challenge, but Yes, they're not automatic, and you do some probing, and I would suspect this group, if Nancy's going to and Amanda are there, there'll be some probing, and you'll have a hearing. I think I'd look forward to it, because sitting here today, I've learned a lot more than I knew than when I walked in the door.
I just wanted to change the subject for one moment. My name is Brian Burke, and I'm an Irish Catholic Democrat from Wolf. I usually look down and say, I don't know what gave that away. But the question that I had, and I understand exactly what you were talking about the single-payer system. A couple of days back, I think his name is Brodsky, had an article in the TU, and it wasn't so much about the pros and the cons about the single-payer system, as it was more about the timing of when to put it on the governor's desk. And in that article, he also mentioned a fellow's name, I hope I pronounced it right, Richard Godfrey, who has been screaming for the single-payer system, I believe, for almost as long as a stick bit.
For, I think almost 20 years.
Yeah. Now, they were saying that he's probably going to try and go forward now that the guys with the white hats all control everything. Do you think that's going to happen? And if you do, how do you think that's going to turn out?
I think I mentioned that earlier. I don't think it will turn out
correctly now, because you need participation of the federal government, and you need what they call waivers, and the federal government controls Medicaid, Medicare, the Affordable Care Act, and other various federal programs. And California, which you would expect under Governor Brown, would have been pushing for it already. I already, in anticipation of being in the majority, I had someone in my office collect his quotes from the last 2 years that he can't face single payer at this point in time. Ultimately, not this year. Ultimately, I think that we will resolve the healthcare crisis in some form of Medicare for all or a one-payer system. But it's not going to be, as Brodsky said the other day, put on someone's desk and it'll be approved. I would expect that the New York State Senate will have at least a year of hearings.
Let me just, if you don't mind, Bernie Sanders has always been advocating Medicare for all.
And they haven't done it in Vermont, even though, right.
That's correct. But you know, the way I look at it, Medicare for all, Medicare can be expensive. I mean, it's $134 a month, and if you have your wife, it's twice. And then you have to buy the Medigap insurance and such like that. And when you retire, you know, you're not living off what you used to have, unfortunately for a lot of us. Now, instead of Medicare for all, wouldn't it be better if everybody started saying Medicaid for all? Because isn't Medicaid really a single-payer system?
Yeah, but I'm not going to get into a semantical argument. I want to make sure that everybody has a right to health care.
And it's up to us to find the best possible way to provide that health care. And if it's a delivery system that reduces the price of pharmaceuticals, which it can if it's a big entity purchasing and get some leverage to the purchase of drugs, you get out all of the non-healthcare elements. As I mentioned before, TV advertising to me is not healthcare. And all the competing, and there's a way to have a system, a medical system that makes sure that we provide for healthcare in our rural areas, which are not being served properly now, and at times there's an overabundance in other particular areas. There's reimbursement for some types of care that I think are exorbitant, out of whack, and it's underutilized in medical services in other areas. So yeah, there's a long way to go, and Medicare or Medicaid for all will not happen this year. Next year.
Oh.
Thank you again.
Thank you. Thank you very much, Senator Breslin.